4 days ago, you cut your thumb on a piece of sheet metal in the garage. It wasn't deep. You didn't even bandage it. You ran it under the tap, said something that wouldn't make it past a PG-13 rating, and went back to whatever you were doing. That was Tuesday. It is now Saturday, and you are lying in bed unable to remember if you're cold or burning up, because somehow you're both at the same time. Your heart is slamming against your ribs like it's trying to get out of a building that's on fire, and it kind of is. You didn't get bitten by anything exotic. You didn't travel anywhere dangerous. A house cut, on a Tuesday, is currently in the process of trying to kill you, and your own immune system is the one holding the knife. Here's what Hollywood does with this. In every hospital drama you've ever watched, infection is a 5-second plot device. Someone gets a wound, a doctor says the word infection with a serious face, a bag of antibiotics goes up, and by the next commercial break, they're sitting up in bed eating Jell-O. What you almost never see is the actual mechanism, because it's not visually dramatic in the way a car crash is. There's no flesh-eating bacteria crawling up someone's arm on screen. What's actually happening is quieter, and it's happening inside roughly 1.7 million Americans a year, and it kills more of them annually than opioid overdoses, breast cancer, and prostate cancer combined. This is sepsis, and the horrifying part isn't the bacteria, it's what your own body decides to do about it. There's a way out of this. It exists, and it comes down to a handful of words said at the right moment. We'll get there. But first, you need to understand what's already happening inside that thumb of yours. Somewhere in that small, forgettable wound, bacteria got past your skin, which is normally a pretty solid wall. Your immune system noticed almost immediately, the way a smoke detector notices smoke. It released a chemical alarm called cytokines, tiny signaling proteins whose entire job is to alert nearby immune cells that there's an intruder and to send reinforcements to that exact location. For most cuts, this works perfectly. The alarm stays local. A little redness, a little swelling, a scab, done. You've had this happen 100 times in your life without noticing. What's different this time is that the infection got into your bloodstream. And once bacteria are circulating through your entire circulatory system, instead of sitting quietly in one spot, your immune system's local fire alarm turns into something else entirely. It goes systemic. Your body starts pumping out cytokines everywhere, all at once, into every organ. And here is the part that should terrify you more than the bacteria itself. This response is not a malfunction. It's your immune system working exactly as designed, just at a scale designed for one room being applied to the whole building. Doctors call it a cytokine storm. Imagine your body's fire department getting a report of a stove fire in the kitchen and responding by flooding every room in the house simultaneously, kicking down doors that didn't need to be kicked down, and soaking rooms that were never on fire. The intention is protection. The result is structural damage everywhere. The first thing that storm does is attack your blood vessels. Your vessels have a lining called the endothelium, essentially a smooth, tightly sealed inner tube that keeps blood exactly where it belongs. The cytokine storm degrades that lining. Your vessels start to dilate, widening out across your entire body at once, which is why, if someone touched you right now, your skin would feel unusually warm despite the chills you're experiencing internally. Warm shock, it's called, and it is the cruelest kind of misdirection because it feels like your body fighting a fever when it's actually your blood pressure quietly collapsing. With your vessels wide open everywhere simultaneously, there isn't enough pressure left to push blood to where it actually needs to go. Your blood pressure begins to fall. This is the beginning of septic shock, and your heart, sensing the drop, does the only thing it knows how to do. It beats faster, harder. Your pulse right now is probably somewhere around 130, doing sprinter's work while you lie perfectly still in bed. At the same time, those degraded vessel walls become porous, leaky, like a garden hose full of pinholes. Plasma, the fluid part of your blood, starts seeping out of your vessels and into the surrounding tissue. This is called capillary leak, and it's why sepsis patients often develop visible swelling in their hands, feet, and face, even as the blood pressure inside their vessels keeps dropping. You are simultaneously flooding and drying out. Your body is losing the argument with itself on two fronts at once. Then comes the part almost nobody outside a hospital has ever heard of, and it's arguably the cruelest twist in the entire process. Your blood is still carrying oxygen. Your lungs are still working. In theory, your tissues should be fine. But the same inflammatory chemicals flooding your system are damaging your mitochondria, the microscopic engines inside every one of your cells that convert oxygen into usable energy. Even with oxygen physically present in the bloodstream, your cells lose the ability to use it. It's called cytopathic hypoxia, and the closest comparison is a car with a full tank of gas and a broken fuel injector. The gas is right there. The engine simply can't process it anymore. Your organs begin starving in the presence of exactly the thing they need to survive. Somewhere around this point, your blood makes another catastrophic decision. All that vessel damage looks, to your body, exactly like massive trauma. the kind you'd get from a car accident. So your coagulation system activates everywhere at once, forming microscopic clots throughout your smallest vessels, in your kidneys, your lungs, your liver, your brain. These clots choke off blood flow to the very tissue they're supposed to be protecting. And because your body is now spending all its clotting material on clots you didn't need in places you didn't need them, you start running low on the clotting factors required to actually stop bleeding anywhere else. This is disseminated intravascular coagulation, and it means you're now clotting and hemorrhaging inside your own body in different locations at the exact same time. Your kidneys are usually the first organs to formally surrender. Deprived of steady blood pressure, the millions of microscopic filtering tubes inside them begin to fail, and your urine output slows, then nearly stops. This is called acute kidney injury, and it means the organ responsible for filtering toxins out of your blood has quietly clocked out. Around the same time, fluid begins accumulating in your lungs as those same leaky vessels let plasma seep into the air sacs, meant to hold oxygen, not liquid. This is acute respiratory distress syndrome, and it means you start feeling like you're breathing through a wet towel because, functionally, you are. Your brain isn't spared either. Reduced blood flow combined with the circulating inflammatory chemicals causes something called septic encephalopathy, which is a clinical way of saying your thinking gets foggy, then confused, then genuinely incoherent. Family members who visit sepsis patients in this stage often describe a specific unsettling shift in personality, a person who is technically still answering questions but isn't entirely home anymore. And underneath the confusion, patients frequently report one particular sensation that shows up so often in medical literature it has its own name. Impending doom, not vague anxiety. A specific, certain bone-deep conviction that they are about to die, arriving before any monitor in the room has flagged anything catastrophic. Doctors have learned, over decades, to take that sentence seriously the moment a patient says it out loud, because the body appears to know things the numbers haven't caught up to yet. From here, it's a cascade of dominoes falling into each other. Your heart, already working overtime, starts to weaken directly from the circulating toxins, a condition called septic cardiomyopathy. Your liver, trying to process the flood of toxic breakdown products, begins failing too, which is why some patients develop a yellow tint to their skin in the final stages. Multiple organ dysfunction syndrome is the formal term for what's happening now, and it means your body's separate systems, kidneys, lungs, liver, heart, brain, are no longer failing independently. They're failing together, each one making the others worse, in a loop that has stopped waiting for permission. Blood pressure that medication can no longer support. A heart that finally runs out of runway. And somewhere in a hospital bed, or in a house that never made it to a hospital, the person who started this whole process with a cut on their thumb is gone. Sepsis doesn't announce itself with a wound reopening dramatically or a fever spiking on a screen while music swells. It ends the way it began, quietly, systemically, everywhere, all at once. Now, an actual case, because this isn't hypothetical, and this exact story shocked an entire country. May of 1990. Jim Henson, the man who created Kermit the Frog and taught an entire generation of American children how to read, count, and be kind to each other through Sesame Street, made his final public appearance on the Arsenio Hall show. He mentioned to his publicist that he had a sore throat and felt tired. Nothing dramatic, the kind of thing anyone would brush off. Over the following days, that sore throat progressed into what he assumed was a bad cold. He kept working. On May 15th, at 2 a.m, he woke up struggling to breathe and coughing blood. According to his family, he said he felt like he was dying. And even then, he hesitated to go to the hospital because he didn't want to inconvenience anyone. By the time he was admitted, Streptococcus bacteria had already triggered toxic shock syndrome, the same runaway cascade you just walked through. Less than 24 hours later, the man behind some of the gentlest characters in American television history was dead at 53. His doctor said, afterward, that Henson likely would have survived if he had walked through the hospital doors 12 hours earlier. 12 hours. That's the entire distance between a man remembered for decades of joy and a headline that stunned the country in a single afternoon. So, here's how you don't become that headline. The single most important fact about sepsis is that it is a race against a clock that starts the moment infection enters your bloodstream, and every hour you delay treatment measurably increases your risk of dying by roughly 7 to 8% per hour once shock sets in. This is why emergency medicine calls the first hour after suspected sepsis the golden hour. Doctors don't wait for definitive lab results. They draw blood cultures, then start broad-spectrum antibiotics immediately, because guessing correctly and fast beats being certain and slow. Your job, if you're not yet unconscious in a hospital bed, is recognition. And recognition means learning to say 4 words to a triage nurse that cut through every other conversation in that waiting room. I think this is sepsis. Say those exact words. Not, I don't feel well. Hospitals are trained to move fast on that specific sentence. The warning signs worth memorizing spell out roughly to this. a fever that comes with shaking chills, a heart rate and breathing rate that both feel unusually fast, confusion or disorientation that a family member notices before you do, and skin that's unusually clammy or mottled. If you have a known infection, a UTI, a wound, pneumonia, and any of those symptoms show up together, you do not wait it out with fluids and rest the way you would with a normal flu. You go. Once you're in a hospital and sepsis is suspected, the treatment is aggressive by design. Large volumes of IV fluid to counteract that vessel leak and support your collapsing blood pressure. Antibiotics started before your doctors even know exactly which bacteria they're fighting, because the alternative, waiting for a lab culture, can cost you the hours you don't have. Vasopressor medications to chemically force your blood vessels to constrict again if fluids alone aren't holding your pressure up. And a blood test for something called lactate, a byproduct of the exact cellular oxygen starvation you just learned about, used as a real-time scoreboard for how much trouble your organs are in. The survival rate for sepsis caught and treated in that golden hour is dramatically higher than for cases where recognition comes late, which is medicine's polite way of saying the difference between living and not living is frequently just you deciding to stop being polite about your own symptoms. Your thumb heals in a week either way. Whether you're around to see it is entirely a function of how fast you said something. Sepsis has been called blood poisoning for over a century, mostly because it sounds dramatic enough for a Victorian novel. The truth is less gothic and more bureaucratic. It's your own immune system filling out the wrong paperwork at scale, and paperwork errors, it turns out, can be just as lethal as anything with fangs. Subscribe to 199 Last Seconds, because next episode, your body doesn't even get a warning cut on the thumb to work with.